Okay, well, hey guys, what time is the best time to go see your dentist?
What?
2:30. Ah! Do you get it?
2:30.
Oh, sorry about that one. Hey, thank you for joining us. Dr. Chris Elliott, Chief Medical Officer here at Nebraska Total Care, bringing you the Whole You podcast. Thank you again for joining us. Nebraska Total Care is a health insurance company that insures literally hundreds of thousands of people all across the state of Nebraska. Whether you're old or young, live in western Nebraska, eastern, central, north or south, in the city or rural or frontier areas, we have representatives there just ready to help come alongside you, support your health any way we can. That is our mission here at Nebraska Total Care. So today our topic is dental care, which is really exciting. I have Dr. Holly Randoni with me and Nancy Laughlin-Wagner again. Dr. Randoni is our dental director here at Nebraska Total Care. Tell us just a little bit about yourself and what you do here for the plan.
Yeah, so I am a pediatric dentist in Hastings. My husband and I have 3 young girls that keep us busy. I've lived in rural areas of Nebraska for most of my life. And some of my previous engagements that have kind of led me to this position are legislative efforts through the Nebraska Dental Association, and I've been involved through my Academy of Pediatric Dentistry as a public policy advocate for about 12 years. So I've used my skills and knowledge to be able to help me in this role, and I'm excited for the years to come in this position.
That's really great, and it's been such a benefit and so amazing having you on staff here at Nebraska Total Care since January with our new dental plan. So welcome and appreciate you. And Nancy Laughlin-Wagner, our Vice President of Population Health. We've seen you before, but just really quickly tell us a little bit about yourself.
You bet. I am, a registered nurse. I've worked in healthcare for over 20 years and joined Nebraska Total Care about 3 years ago, and just really excited to be here and working alongside our team. I think they're really compassionate, passionate, and just really great advocates for our members.
One thing that, kind of like I mentioned, obviously we're a health insurance plan, but there's so much research, scientific studies, and just knowledge anymore that how much the mouth, dental, gums, the health of your teeth and so forth affect your overall physical and mental well-being. And so, Dr. Randoni, tell us just a little bit about, how does routine dental care help your overall health?
So, a healthy body really starts with a healthy mouth, and there is research, like you said, to suggest that there's systemic illness associated with dental disease and gum disease called periodontal disease. So, the 3 main kind of illnesses that come to my mind would be heart disease, diabetes, and then really the well-being of an unborn child, of an expecting mother. So, we suggest that expecting mothers still continue routine dental care. And, for a woman who has periodontal disease, it could lead to premature labor or low birth term weight. And so really as you said, the integration of medicine and dentistry has just become so collaborative over the years, because really we're just trying to treat the whole person. We suggest that kids start coming around their first birthday or 6 months after the eruption of their first tooth. And that visit really entails a lot of anticipatory guidance. So we're talking a lot about things such as, thumb sucking, pacifier use, how to prevent traumas or what to do in young kids, talking about dietary counseling, oral hygiene instructions, how do you get your infant to lay there or sit still while you're brushing their teeth, even if they're crying and squirming, and what are some techniques you can use. Really talking a lot to parents about not sending their infants to bed with a bottle of milk, because that can cause baby bottle tooth decay. So we see that a lot in our office. The milk will sit in the mouth overnight, and then it does rot their teeth. And in young kids, when they're not able to sit in the dental chair, it leads to them having to go under anesthesia to have their teeth fixed. So it's really treating the whole person.
Yeah, that's fantastic. And it is. It's kind of like, really? Need to take my kid in when they're 1 year old? But like you say, so much of that just healthy habits, education that those parents can take throughout the life of their little one, and just get them off to the right start and just be healthy overall. I think that's really neat. We do a lot of initiatives. We put a lot of effort into trying to get the people that use our medical care into the offices and see their doctors, the dentists and so forth. And why exactly do we do that?
Well, Well, that's our purpose. That's what we're here to do. We're really here to help support people to have health. And part of that is getting into the doctor, getting into the dentist, and making sure that you have what you need to achieve the best health outcomes that you possibly can. So that's really our mission. That's what we're here for.
Exactly. You think about, okay, if you wait until you're sick, well, then you might have one symptom, but it might have just, steamrolled into a lot of different other illnesses throughout your body. Whereas if you're doing that health maintenance and preventative health care, just like dental care and so forth, then you stay healthier for a lot longer. And we've accomplished what we're after.
Yeah,
so that's really neat.
I think Dr. Randoni's example of just that education you could give to a new parent about the importance of not giving a bottle at bedtime to go to sleep with and what it can do to prevent. So it's a great example.
Yeah, that's really neat. Dr. Randoni, I know that there's a little controversy. It seems like you hear it kind of is really popular and then it dies out and so forth. It's about fluoride. And even in Nebraska, I believe that there's some communities that put fluoride supplementation in their water and some communities that don't. Can you talk a little bit about that from a expert dental side?
Yeah, so, really water fluoridation is the primary preventive way that we can prevent dental caries. Children that grow up with lifetime water fluoridation have been shown to have less dental disease over their lifetime than someone who lives in an unfluoridated area. When a community has water fluoridation, they're really trying to appropriately monitor that at a safe level so that there would be no negative health outcome. Water fluoridation, fluoridation supplements, though, it's really based on an individual basis, so that's kind of between the provider and the patient because you are taking in a lot of aspects of that whole person into account. So you're asking questions about, do they use fluoride toothpaste? Do they live in a water community that has fluoride? Are they taking any other supplements? There's other dietary sources of fluoride, things that we eat naturally occurring. Shrimp has fluoride, some fruits have fluoride, some nuts have fluoride. So you really have to take all of these things into account when you're trying to come up with a preventive regimen for that particular patient. So it's not a set schedule or recommended dose. It's really taking into account all these factors and base it on that.
Oh, that's really interesting. I think that's really good to kind of take into effect so that it's not just a cookbook, one size fits all. Right. And so if you bring a child into the office, I know you can kind of, I don't know what they call, paint the fluoride on the teeth. What makes you decide to do that on one person and not the other?
Yeah, so that would be a topical fluoride supplement, and really we're doing a caries risk assessment on that patient. So a caries risk assessment is a series of questions that we go through, and like I mentioned before, some of those aspects of their lifestyle. And someone who's at low risk for caries, they might only come to the dentist and have their appointments in fluoride every 6 to 12 months. Someone who's at medium or high risk might come to the dentist more often, maybe even 4 times a year to get that fluoride treatment.
Oh, very good. Okay, great. And so what would you say is the actual recommended schedule for preventative dental care overall?
So really that's kind of an individual basis, again, based on lifestyle factors and oral hygiene, things like that. So it could be anywhere from every 6 months to potentially even 4 times a year. Okay,
very good. Nancy, since the plan just really started supporting our dentists and our members going to the dentist, we've really done a lot of education, put forth a lot of programs with our care management team and so forth on how to support this. Tell us a little bit about that.
Yeah, I'd be happy to. So really the role of care management is to get to know the member. And so we do that by just having a lot of conversations, asking a lot of questions. And as it relates to dental care, we ask questions like, do you have any concerns or needs? Have you been to the dentist? When's the last time you went? And through the course of those conversations, we can identify if there's any barriers. And if there are, our care management team can help. So, for example, if they would find out, that someone doesn't have a dentist that they've seen, well, we know it's important to get in for that preventive care that we've been talking about. So our team can kind of research who's a dentist in network that's going to be located in a place that's close to where the member wants to be seen. And then we can help them call and set up that appointment. We can, if our member doesn't have transportation, we can arrange that so they can get to and from the appointment. And then we just also offer a lot of education and resource support for the importance of dental health.
Well, thank you for that. Yeah, I appreciate all the work that your team does and so forth. Now, Dr. Andoni, you and I know have had several conversations about this concept of a dental home, and I know it's a passion of yours, and it sounds really exciting. Can you kind of describe what we mean when we talk about a dental home?
Yeah, so dental home is a patient-provider relationship that is all-inclusive of all aspects of oral health, comprehensive, continuous, compassionate, patient-centered. We really want a dental home established by the age of 12 months, and that will help children and families be able to optimize their oral health over their lifetime. And when we have kids come in and have those dental homes at such a young age, the research does suggest that there will be less money spent on dental care. There will be less dental disease over their lifetime, and they will have to come in for potentially less dental treatment, and causing a risk for a negative experience in a young child that could cause dental anxiety or dental fear, which much of our older generations have that sort of dental anxiety, and we really want to try to have those younger generations grow up without that. So it's really important to start bringing them at a young age.
And again, if we do that and we take care of their oral and dental health, the rest of their physical well-being will be as well. And so a program that I know I've heard you talk about is possibly, going out to family practice doctors, maybe general dentists that aren't actually specialized in pediatric dentistry and so forth, and kind of teaching them, the concepts of how to really see these young babies starting from 1 year old, because I know a lot of people, if you're used to seeing adults all the time on the doctor side, and I'm sure it's probably similar on the dental side, it's like, oh my gosh, I have a squirmy 1 or 2 year old, how do I even examine them and so forth. Tell us a little bit about that program that is, I know it's not up and running yet, but we're kind of working on it, right?
Yeah, so, we do have dental deserts all across Nebraska, and there's only approximately 57 or so pediatric dentists in our state right now. So a lot of these general dentists are having to see the majority of their populations in their area, and a lot of general dentists may not get training on how to see these really young kids. So if we can get them feeling comfortable with doing what we call a knee-to-knee exam, which is the patient is across the doctor and the patient's lap, you're laying that child back, they might be crying and they might be squirmy, but trying to get them more comfortable and giving them tips and tricks on how to see those young ones, then again, we can try a lot of those preventive efforts, and we can try to minimize the dental disease for that provider, or excuse me, that patient.
Yeah. And there are, with the breadth of our state and such rural areas and so forth, I know there's areas where you can't get the right specialists for medical care, and it's really in that way for dental care as well. And so we're trying to eliminate those deserts for dentistry as well as medical and so forth. So I think that's really neat. And the whole concept of us bringing dental into our medical health plan as well. And so, Nancy, you had talked a little bit about how our care management team is supporting our members and our providers. I know one thing that we've heard from some of the providers is, no-show rates in their offices really is kind of an issue. And can you, I know we've been working with one pediatric dentist in the state that really asked us to kind of help him decrease his no-show rates. Can you tell us a little bit about what Nebraska Total Care is doing specifically there?
Yeah, I think that's super. It's been a really nice collaboration. So we just started with this dentist to say, what could we do to add that extra layer of support to the members to make sure that they're able to get to the appointment? And so we get the list of who's on the schedule, and then our care management team does the outreach. And so we're calling and talking either to the member or potentially the parent or guardian, and to understand if, do they remember the appointment? Do they have transportation to the appointment? Are there any other concerns? Maybe it's a fear of seeing a dentist. And we try to address any of those concerns or needs to make sure the visit can happen. And so far, it's been great. The people that we've talked to have been receptive of that outreach and appreciated it. And so we hope to see, success from that program.
Yeah, again, I think it just goes to say, we are, as a health plan, willing to go that extra mile, to support our members, to support our providers, and just really get people the care they need, which is really great. So Dr. Randoni, you know, at Nebraska Total Care, a large portion of our member population is Medicaid. We also have Medicare and marketplace plans and so forth. And I know you still have a very busy pediatric dentistry clinic that you, office that you run, and you see patients in on a day-to-day basis. Tell us a little bit about your experience of how it is working with health insurance plans and with the changeover and Nebraska Total Care and other Medicaid plans throughout Nebraska that took this management on this year.
So, you know, I think it has been just awesome to see how all these plans have worked together. You know, I mean, when in dentistry, you know, we had one MCO for 5 years. You know, many dentists were a little bit nervous about how that was going to be going to 3 years, but I feel like the collaboration between all of our plans has been amazing. The transition has been very seamless. My front office has been very pleased on how well things have worked and how easy the transition has been. And it has, I think it's just amazing to see all of us work together to be able to treat our entire population of our state and help with their dental care.
Yeah, oh, that's great. Really good to hear. You know, we spoke a little bit about dental deserts, and not everyone throughout our state has the same access to dental care. And Nancy, at Nebraska Total Care, it really is our mission to help expand where we can see patients and our members can be seen by dentists. I know we're working with community organizations, we're working with local health departments, we're working with different health centers scattered throughout the state. You know, tell us a little bit about that, what we are doing to really support them and really try to increase access throughout the state for dental care.
Yeah, I will. So there's one in particular that I really want to talk about. So a couple of years ago, the Centene Foundation and Nebraska Total Care partnered with the Health Center Association of Nebraska. So the Health Center Association's membership are the federally qualified health centers, or we call them just FQHCs for short. And the FQHCs are just really dedicated to delivering high quality care. There's physical health care, there's mental health care, and then there's dental care. So the federally qualified health centers are just really dedicated to delivering high quality care to the members that they serve, and they often serve underserved people in Nebraska. And they can be located in an urban setting, a rural setting, or even a frontier setting. And so through this collaboration, we were able to kind of financially support what we call Project Access. And Project Access is really dedicated to how do we improve healthcare access in Nebraska. So the FQHCs get to choose what's important to them to improve access. Is it recruiting a new provider to provide that care? Is it potentially looking at the operations? How do we run our daily operations, and can we work in some more open appointments to see people? Is it physical capacity? You know, do we need to build a new exam room? Do we need to have a mobile clinic that we can take? And then the last thing is this Project Access is saying, what's the long haul game plan? How do we have a workforce in Nebraska that's dedicated to healthcare? You know, what can we do? So we're kind of partnering with different schools and looking at different scholarship options to make sure that the healthcare workforce is robust and growing in Nebraska.
That's really neat. Yeah, you know, it just goes to you know, the idea that here at Nebraska Total Care, you know, we have to do the day-to-day, everyday things to take care of the members and help them get into providers. But we are looking at, you know, long-term as well, just for the overall health of the population of our state, just to really try to increase the care, the access, and the health of our population. So that's really cool. Anything else that you guys would like to touch on that I didn't ask?
I would just say if any of our members out there have a question or a concern, or they need help in finding a dentist, to reach out to us. Call member services and ask for care management, and we're happy to help them get connected.
Exactly. Yeah, use us. That's what we're here for. And so there it is. Thanks again for joining us on the Whole You podcast, brought to you by Nebraska Total Care, where we're really trying to mold and meld the whole person, dental care, behavioral health, medical care, and we just want to come alongside you and help you attain your best health. Have a great day.